Welcome to Wisconsin Doctors. I'm your host, Jessa Jeremiah. We're filming today at Upland Hills Health. We're talking about digestive health and some of the symptoms and problems that you might be experiencing at home, what they might mean, and when you need to seek medical help. We're talking specifically with Dr. Ryberg about heartburn and some of the causes and effects of heartburn, and Dr. Dockman today about cancer prevention and more specifically colonoscopies and what you can expect. It's all right here on Wisconsin Doctors here at Upland Hills Health. We'll be right back. Welcome back to Wisconsin Doctors. We are discussing today digestive health with Upland Hills Health, and we are getting to know Dr. Ryberg today. One of the goals of today's shows is to letting you know as viewers that there's a lot of resources right here that you can utilize from your doctors here at Upland Hills Health. Thank you so much, Dr. Ryberg, for chatting with us today.
Thank you for having me.
So I have a lot of questions, but we're going to get to know Dr. Ryberg a little bit before we dive into our more specific topic of heartburn with you. I'm curious to know a little bit about your background.
I'm from Eau Claire, Wisconsin. I was born and raised there, and I went to college in St. Paul, Minnesota at the University of St. Thomas. After college, I went to medical school in Milwaukee at the Medical College of Wisconsin. And then from 2011 to 2016, excuse me, I did my surgical residency at the Marshfield Clinic. I came down here shortly thereafter, and in August of 2016, I started working at Upland Hills Hospital as a general surgeon.
And I understand outside of general surgery, you are also, of course, a family man. Tell us a little bit about some of the personal life.
Yep, I'm married to my wife, Melissa. We've been married for 6 years, and we have a son who's 10 months old, and his name's Henry.
Such a fun age. I love that.
He's keeping us very busy.
Yes, he'll keep you on your toes at home, no doubt. Now, here at Upland Hills Health, as you mentioned, you're a general surgeon. So walk us through a little bit about what that means.
So a general surgeon has a broad scope of practice. We typically do intra-abdominal operations. We remove gallbladders, we do appendectomies, removing the appendix for acute appendicitis. We also operate on people on the colon for benign disease like diverticulitis, as well as malignant disease like colon cancer. We also fix abdominal wall hernias. That's one portion of our practice. We also do procedures in the office, skin and soft tissue procedures where we take out lipomas, moles, skin cancers. And then we also perform endoscopy, upper and lower endoscopy, which are EGDs and colonoscopy. Colonoscopies are typically done for colon cancer screening or people that come in with certain symptoms, and EGDs are done for a variety of symptoms that people present with as well.
Goodness, that's a lot on your list. And I think a lot of viewers at home, we think, of course, in terms of some of the symptoms that we're experiencing that might lead us to needing some of these surgeries. One of the things that we're going to dive into a little bit more, as I stated earlier, is talking about heartburn, something that just about everybody has experienced at one time or another. There's a lot to know on this topic, wouldn't you say?
Absolutely. Heartburn is a very common symptom that I would say the vast majority of people have experienced at some point in their lifetime. Fortunately, a lot of people experience it very rarely, and it doesn't really affect their life. Other people have more severe symptoms, and those are the people that we really want to take a closer look at and see if we can maybe improve or relieve those symptoms altogether.
And again, the discussion today being about digestive health in general, we're going to dive more into the topic of heartburn, and we're going to learn a little bit about some of the resources that are available here, like Dr. Ryberg and your vast knowledge. Thank you so much for sharing a little bit about yourself.
Sure, thank you.
We'll be right back with more Wisconsin Doctors here at Upland Hills Health after the break. Stay with us. Welcome back to Wisconsin Doctors. If you're just tuning in, we've been filming here at Upland Hills Health talking about digestive health. A big topic, definitely, that we're covering with Dr. Ryberg, general surgeon here. And thank you very much for sharing your expertise with us today.
Thank you for having me.
So again, digestive health being a big topic, heartburn, of course, one of those topics that a lot of people suffer from.
Sure.
Let's talk a little bit about how prevalent it is. Is it a common complaint?
It is fairly common. I would say the vast majority of people suffer from heartburn at some point during the course of their life. They may not know exactly what it is, but nearly everyone probably has had an episode of heartburn at some point. When we talk about heartburn, what we're talking about is retrosternal, meaning behind the sternum, behind the chest, burning type of pain that can go up the chest. That is typical heartburn, and that's really the most common symptom of gastroesophageal reflux disease. Reflux disease is when you have stomach contents, gastric contents, going back up into your esophagus. Normally, there's some physiologic reflux that happens after meals, and that's normal in every single person, but it becomes more of a pathologic process when that happens and it starts to cause symptoms for people, or it starts to cause damage to the lining of the esophagus. That's when we typically call that gastroesophageal reflux disease.
I see. Okay, so it's important to know when heartburn is just heartburn or when it could be something worse. And how do you really know if it's something more than just your common everyday heartburn?
It's a good question. Typically someone that presents with heartburn alone and they've had it long standing, we typically try to treat them with lifestyle modifications and medications and see that if that improves their symptoms. The vast majority of people will have some improvement. Simple things that people can do. If they're overweight, they can attempt weight loss. Elevating the head of bed when they're sleeping at night. A lot of times people have heartburn after they have a meal, a late dinner, and then they go to bed, so elevating the head of bed. The third would be dietary changes, eliminating those triggers that can weaken the muscles down in the lower esophagus and predispose people to reflux disease and trigger that heartburn symptom. So those would be three types of lifestyle modifications people can engage in. And also the last, and probably maybe the most important, would be medications. We have anti-secretory medications that we can give people that can decrease the production of stomach acid, and a lot of times people will get significant symptom improvement, if not complete relief of their heartburn. Heartburn is the most common symptom of reflux disease, but certainly there are more alarming symptoms, and those are the people that we want to take a closer look at and possibly evaluate with interventions to make sure that there's nothing else more serious going on.
Boy, and even heartburn in and of itself can certainly feel serious, as it often is painful. I want to also discuss GERD. Many of us may have heard of GERD, but don't truly know what it is. So what is it? How prevalent is it?
So GERD is gastroesophageal reflux disease. Probably 10 to 20% of the population has that. It becomes a problem when it starts to become symptomatic, where it affects your quality of life and people have symptoms on a more frequent basis. And it can also affect the lining of the esophagus and cause mucosal damage. The most common symptom, again, is heartburn that people experience with that retrosternal pain that we talked about. Other symptoms people can experience include regurgitation. They may have a taste in their mouth, or food may pop back up into the back of their throat. They can get dysphagia, which is trouble swallowing. They may have difficulty with certain types of foods, maybe solids, maybe meats, things like that. Other symptoms, kind of atypical symptoms people can have from reflux disease, that can cause a chronic cough. They can get hoarse from that as it irritates the vocal cords. It can cause erosion of the teeth. The enamel can wear away, so it can certainly affect your dentition. And it can certainly be mistaken for other symptoms. And those people that have kind of those atypical or concerning symptoms, those are the people that we want to take a closer look at. Certainly some people present with what we call alarm symptoms. Those people can have weight loss. They could be throwing up blood. Food can get stuck in their distal esophagus. Those are real concerning symptoms where we want to take a look and do further interventions or procedures to make sure that there's nothing else concerning going on.
Wow, and that sounds like a lot of negative influences on a person's everyday life if you're experiencing something like that. I want to touch on the topic too about chronic heartburn and some of these things that you're talking about here. They could lead to more serious conditions, as you mentioned, but possibly even cancer?
Sure. Some of the complications of long-term reflux disease are esophagitis, where the lining of the esophagus becomes inflamed and irritated. That can cause bleeding. People can develop strictures, which are narrowings at the distal part of the esophagus, and that can really affect people's ability to swallow. People may come in and say, I haven't been able to eat certain meats for the last 3 or 4 months because every time I do it gets stuck. Some people actually have to come into the hospital when food gets stuck and have to have a procedure done to get that food out. So esophagitis, strictures, Certainly another thing that we call Barrett's esophagus, where the cells in the distal esophagus change from one type to another, and that can predispose people to cancer. And then the most serious of complications obviously is people can develop cancer of their esophagus. And so anytime someone presents with those very concerning symptoms, that's someone that we want to take a look at and possibly do an EGD on, where we put a scope down their mouth and take a look on the inside and make sure that there isn't anything concerning like a cancer or other ulcers or any other concerning findings like a stricture.
So if you're at home watching and you're experiencing any of these symptoms or even just have some questions, what would you recommend be the first step?
A lot of people typically are seen by their primary care providers, and they may have a diagnosis of GERD and they may try lifestyle modifications and medications. And for those people, if they have good symptom relief and they are not, and their quality of life is not being affected, those are the people that that are doing well, and that's great. The primary care providers do a great job treating those people. We're looking at the people who maybe have tried those things and those haven't relieved their symptoms, or they are having worsening symptoms despite medical therapy. Those are the people that we want to take a closer look at and pursue a more thorough workup and make sure nothing else concerning is going on.
Good information, a wealth of knowledge. Thank you so much, Dr. Ryberg, for your information.
Thank you for having me.
We've got more topics on digestive health when we return here at Upland Hills Health after the break. Stay with us. Welcome back to Wisconsin Doctors. We've been filming here today at Upland Hills Health. If you're just tuning in, this is a show all about digestive health. We got the opportunity to talk a lot about heartburn and some of the effects it could be having on you and your loved ones and some things you should look out for. We're going to talk now with Dr. Dockman, and Dr. Dockman is with Upland Hills Health. We're going to talk about colonoscopies specifically later in the show. First of all, thanks so much for joining us.
Thank you for having me.
I want our viewers at home to get to know Dr. Dockman a little bit before we talk more about our topic at hand. Give us a little bit of your experience, your background.
Well, I've been a surgeon in the state of Wisconsin for 23 years, all of which time has been spent at Upland Hills Health. I'm the chief of surgery there and have been the chief for about 20 years. I have a very broad practice of surgical and diagnostic services, and I came from a residency in Michigan where I trained as a surgeon there. And so I've been a proud member of a growing hospital community for many years.
You certainly have, and I'm sure that keeps you busy in your day-to-day life. I do want to mention and talk a little bit about some of your hobbies outside of the four walls of Upland Hills Health.
Well, before I became a physician, I was a musician and still am, and that takes up a lot of my personal time after family chores and responsibilities are finished. Fortunately, at this point in my life, my children are grown and I have more time for my extracurriculars, so I'm a composer and a recording artist.
Musician and physician, not a bad list, and family man, of course. Let's talk a little bit more about your role at Upland Hills Health. Give us, you mentioned that it's really a broad spectrum of things that you cover. Give us some details and specifics.
Yeah, so I practice general surgery, which is a nationally recognized specialty. And we general surgeons are the keepers of many different techniques and teach most specialty surgeons how to do what they do. So almost every surgeon out there, whether they're a heart surgeon or a ear, nose, and throat surgeon, etc., has to actually do a general surgery program before they can move on. So anyway, general surgeons do things like appendectomies, gallbladder removal. Many of us practice breast cancer surgery. I do. Many of us do endoscopic interventions like colonoscopy and gastroscopy. We treat disorders like heartburn, hernias, colon cancer, hemorrhoids, trauma, bowel obstructions, liver disease, pancreatic disease, diseases of the spleen. So basically anything from the bottom of your neck to the bottom of your belly we're involved in, and
Wow.
sometimes even more than that.
Quite the list. You mentioned in there colonoscopies, and that's the topic we're going to be covering more in depth after break, preventing cancer, and some tips for people at home, even talking a little bit about at-home testing versus care with a physician. So thank you so much for some background, Dr. Dockman. We'll be back with some more questions for you after the break. Stick with us here on Wisconsin Doctors. We're at Upland Hills Health. We're talking cancer screening and colonoscopy after the break. Stay right there. Hi, and welcome back to Wisconsin Doctors. We've been filming today at Upland Hills Health, talking about the broad topic of digestive health. Before the break, we got to know Dr. Dockman a little bit, and thank you so much for sticking with us.
You're welcome.
As promised, we've got a lot of questions surrounding cancer prevention and specifics to colonoscopies that I know you are more than well equipped to answer for us today, Dr. Dockman. The first thing I want to cover is talking about colonoscopy and why this screening is really unlike others.
Well, in all of medicine, there is no procedure that in one visit and one short procedure can not only identify a problem that could lead to a cancer, but at the same time address that problem during the same procedure and eliminate a cancer from happening. And that's a colonoscopy in a nutshell.
Unique to others in that way, absolutely. Talking about prevention and whether or not there's something to be concerned about. I think for many of us, viewers at home, myself alike, wondering a little bit about in-home tests. And what are these really doing? Does this replace an office visit?
Well, first of all, there are many different new technologies emerging. The most important thing is that everybody should get screened. And only about 60% of Americans are getting screened. So some kind of screening test is really important, but colonoscopy is the gold standard because not only can it find something before you have colon cancer and stop a cancer from happening, but it also can find a cancer after it happens. The other tests, the in-home tests and the lab tests that are now coming out, the blood tests, they find a cancer after it's already there and don't really allow in the same test for a preventive strategy.
I see, which prevention, of course, is so very important. Now, there's some things that I want to talk to specific to scheduling a colonoscopy at Upland Hills Health. There's a lot of advantages to doing so.
Well, the first advantage is that we actually have human beings that answer the phones. So you won't be put through a large menu of selection options before you get to a person. The second thing is that you'll be able to schedule your colonoscopy much sooner than in larger facilities where there are greater populations of people. The next thing is our facility doesn't have a large parking ramp that you have to worry about. Parking is easy. Also, it's a very short distance from your car to the procedure. Those are just the beginnings of the experience, which I think make a big difference.
And talk to us a little bit about quality of care. You mentioned that we'll be able to make an appointment quickly, but then also what does that mean for results?
Well, we are a Joint Commission accredited hospital. We meet all the standards of the best hospitals. We are a top 100 rural critical care hospital, and we have a 5-star rating. So it doesn't get any better than that. And our standards for medical care meet all of the appropriate guidelines of the various professional organizations that govern how we do things and how we should do things so that we get the best results. We follow all of those guidelines.
If there's a viewer at home that's watching that may be ready to schedule a colonoscopy, maybe they've never had one, maybe it's time, what do they do? Do they contact Upland Hills directly? What's the best method?
The best method is to contact Upland Hills directly and say, I would like to schedule a colonoscopy.
With a real person on the phone.
Yes.
It's that
and
easy.
They will then get you to the right extension to have that happen next.
Such helpful information. If you were to leave our viewers with one last bit of information about the importance of a colonoscopy, what would it be?
Colon cancer is still the #3 killer of people who die from cancer in this country, and we should not even see very much of it at all. It should be one of the most uncommon types of cancers that ever occur in this country, and that's what we're working for.
Excellent information. Dr. Dockman, thank you so much for the information today. I also want to thank Dr. Ryberg for joining us and his expertise on heartburn. And to all of our viewers out there, thanks for watching Wisconsin Doctors. We invite you to see us next time to live longer and live better.